So one thing I wanted to show everyone today was how to identify your behavioral health members using our SDAC tool. So for those of you who are familiar with the tool, this will probably be more of a refresher for you, but for those of you who haven't seen our SDAC tool before, this will be something new, and you'll be able to see at a member level those people that have received behavioral health services within the last year, as well as those people that have received behavioral health diagnosis or procedure codes within the last year. So for those of you who aren't familiar with the SDAC, the website is www.coloradosdac.com. And if you don't have access to it, Drew Casper is actually the approver at Colorado Access, who can approve your access to get access to this dashboard. So the main tool I wanted to show today was our All Members report, which is actually when you log in, and for today's example we'll use RICO 2. So if you're a RICO 2 user, you log into the dashboard. Let's see if we can zoom out here a little bit. So you'll be able to see all your analytics based on your RICO 2 members. And you see that the analytics is based on the roughly 35,000 members which are in RICO 2. And to get to that information where you can see at a member level who those people are behavioral health members, you go down to this All Members report, which is kind of our main care management report available on the SDAC. And to generate that, you would click this All Members link right here. And so I've prepared one beforehand, taking out the PHI so we can actually look at it and not worry about showing off any of that information. So when you click that link, the All Members report link, what you'll generate is this Excel file. And as you can see, this Excel file has a row for each client in the dashboard. So we'll have for all 35,000 members that were in RICO 2, you'd have a row for each one. And kind of some of the first columns here are self-explanatory. Things like client ID, client name, the RICO they're attributed to. So you'll notice in this report, because we generated RICO 2's data, we're only going to see members attributed to RICO 2. And we'll get over here kind of further into the data. But the first column we have for identifying our behavioral health members is going to be this primary chronic description. And just like any other Excel file that's generated, you can turn on the sorting and filtering functionality. So the first one is this primary chronic description category. And if you're trying to identify your behavioral health members, you can actually filter right to those with mental health. So we'll go ahead and do that. So of the 35,000 members in RICO 2, it looks like 2,028 of them have received procedure or diagnosis codes that which would identify them having a primary chronic disease that would be identified with mental health. So actually the primary chronic description category only identifies the driving chronic disease of a member. So for instance, if they have multiple chronic diseases such as diabetes and mental health, the chronic disease grouper that we use identifies which is the primary one and then assigns it to this category right here. So there's a good chance that this 2,000 members doesn't represent everyone with a mental health diagnosis or procedure code within the last 12 months. It only identifies those where it's the primary driver of their total cost of care. So that's the first column you can use to identify behavioral health clients within a population using the SDAC tool. The next one would be over here, our behavioral health tag. So just kind of like I filtered on the other field, you can filter on this BHO tag. And what this is identifying are those members that have received a service that was paid for by a behavioral health organization within the last 12 months. So you can see here by filtering to those clients that we've identified as having that particular tag, you can actually see the behavioral health service that paid for the behavioral health organization that paid for the service. You can also see when that last service was rendered. And by filtering on that field, we can see that we've filtered down to 35,000 out of 3,500 out of the 35,000 total members in RICO too. So the last thing I kind of wanted to show, obviously there's a lot of metrics in this one report, and that's the ability to, so now that we've kind of identified our behavioral health members, we also have the ability to sort on other fields. So for instance, if I'm working with behavioral health clients and I want to also identify those behavioral health clients, for example, who've utilized the ER a lot in the last year, I can go over to that field. So we have our ER visits right here, and I can actually, you have the ability to sort and filter using the Excel functionality. So I could actually filter from large to smallest on this particular field. So now I'm looking at all my behavioral health clients, and then they're sorted by the number of ER visits they've had within the last 12 months. So this is a good way to kind of define hotspotter lists of people that might be good candidates for some sort of outreach or care management. And just like for the ER field, you can do it with any other field in the report. So hospital readmissions, inpatient stays, RX scripts, anything that's in the report.